Dear parents, especially new mothers, Assalamu alaikum. Dr. Zafeer with you. Do you know what your crying baby is trying to tell you? I am crying because I am hungry. I am crying because I have colic. I am crying because I need to be held. I am crying because I am tired and need a rest. I am crying because I am too cold or too hot. I am crying because I need my nappy changing. I am crying because I don't feel well. Today, I am going to address your anxiety about your crying baby and what to do when your newborn cries. On any given day, a newborn might cry for up to 2 hours or even longer. All babies cry when they are hungry. Also, the normal baby has 1 to 2 hours of unexplained crying each day. It is scattered throughout the day. As long as they are happy and content when they are not crying, this is normal. A crying baby is trying to tell you something. Your job is to figure out why and what, if anything, can do about it. Crying is an important means of communication for babies. It plays a crucial role in ensuring the survival, health, and development of the child. Being able to recognize different types of crying is therefore the key to effectively meeting the child's needs and a relief for many parents. How much crying is normal for a newborn? On average, newborns tend to cry for around 2 hours a day. Crying for more than 2 hours a day is unusual. If your baby cries for more than 3.5 hours a day, this is considered high. Most babies cry during the first 4 months of life. Starting at about 2 weeks of age, your baby may cry for no apparent reason and can be hard to console. Newborn behavior is all about sleeping, feeding, and crying. Responding to newborns when they cry helps them feel safe and is good for development. Some newborns become fussy at night. The causes your baby is suddenly fussy in the evening or night is due to growth spurt hunger. Your baby goes through phases of intense growth. Common growth spurts occur around 2 to 3 weeks, 6 weeks, and 3 months. They may be hungry and want to cluster feed. Over time, you might be able to identify your baby's needs by the way he or she is crying. For example, a hungry cry might be short and low pitched, while a cry of pain might be a sudden, long, high pitched. Is it normal for my newborn to cry all night? It is well known fact that babies wake up frequently at night. They fuss, cry, and wail for many reasons, and sometimes for no reason at all. Every baby is an individual. Don't compare your baby to another baby's, and there may be many factors that cause your baby to cry at night. Hunger is one of the primary reasons for a baby crying at night. Why does newborn cries when put down? Babies love to be held, touched, and reassured that you are there. They recognize the smell of their mother, so settling in a cot on their own can often be difficult for them. Your baby is missing your touch, your smell, and attention, and they are letting you know about it. From their very first hours of life, babies will cry when separated from their mothers. Remember, the best sedative in the world is mother's lap. Colic is when babies cry a lot and are hard to comfort. Some babies have frustrating periods of frequent, prolonged, and intense crying known as colic, typically starting a few weeks after birth and improving by age 3 months. What are the signs of colic? This is always the mothers asking. Intense crying that may seem more like screaming or an expression of pain, crying for no apparent reason, unlike crying to express hunger or the need for a diaper change. Extreme fussiness, even after crying, has diminished. If you are concerned about colic, talk to your pediatrician. He or she can check if your baby is healthy and suggest additional soothing techniques. Crying spells often peak at about 6 to 8 weeks and then gradually decrease. What to do if a newborn is crying? To soothe a crying baby, first make sure your baby doesn't have fever. Make sure your baby isn't hungry and has a clean diaper. Rock or walk with the baby. Sing or talk to your baby. Offer the baby pacifier. Take the baby for a ride in a stroller. Hold your baby close against your chest and talk. Take calm, slow breaths and don't be upset and frustrated. Consider what your crying baby could be thinking. I am hungry. Most newborns eat every few hours around the clock. Crying is a late sign of hunger. Look for early signs of hunger, such as hand to mouth movements and lip smacking. I want to suck on something. For many babies, sucking is a comforting activity. Make sure if your baby is not hungry, offer a pacifier. I am lonely. Calmly hold your baby to your chest. Gentle pats on the back might soothe a crying baby too. I am tired. Tired babies are often fussy and your baby might need more sleep than you think. Newborns often sleep up to 16 hours a day or sometimes more. I am wet. A wet or soiled diaper can make your baby cry. Check your baby's diaper often to make sure it is clean and dry. I want to move. Sometimes a rocking session or walk can soothe a crying baby. Or try placing your baby in an infant swing or going for a car ride. I am rather be bundled. Some babies feel most secure when they are wrapped. I am hot or cold. Add or remove a layer of clothing as needed. Too much noise, movement or visual stimulation also might drive your baby to cry. Move to a calmer environment or place your baby in the crib. Is it normal for my newborn to cry all night? Every baby is an individual and there may be many factors that cause your baby to cry at night. Hunger is one of the primary reasons for a baby crying at night. How do you calm a crying baby in 15 seconds? I will just demonstrate you, and this is called the magic baby hold. You take your crying baby like this against your chest. Hold with your left hand baby's both arms and hold the chin also. And put your hand at the bottom of the baby and start doing like this little gentle push from down up for 15-20 seconds or 30 seconds, and you will be surprised to see that your baby stops crying. So this is called the magic baby hold. You can stand up, hold your baby like this and do this maneuver. So this is called the magic baby hold and your baby will stop crying. Tips for the parents and caregivers to calm a fussy baby. Wrap your baby in a large thin blanket to help her feel secure. Hold your baby in your arms and place her body on her left side to help digestion or put on her tummy. Walk your baby in a baby carrier or rock her. What to do if your baby is having too much gases? Sometimes you always feel that there is gases in your baby and you are asking for something. First of all, apply gentle pressure to your baby's belly. Burp your baby during and after feeding. Feed your baby at an angle. Try infant massage on your baby's tummy to relieve gas pressure. Tummy time. Put your baby on his tummy for few minutes. If necessary, use gas drops like simethicone or disflatyl. Important message for parents. Call your doctor straight away. If your baby under 3 months is having temperature 38 degrees centigrade or above, if she is vomiting and refusing feed, if his cry is weak, look dull, not active as before, if she is breathing fast or grunting, if he is having diarrhea, and of course if mother is very concerned and not happy with her baby's behavior. So in these conditions, please call your pediatrician and talk to him. Enjoy your newborn, relax, crying spells will gradually decrease. Stay blessed. Thank you.